Hi everyone, I'm Jjschutte. This is my narrative review for my Public Health 893 Capstone Integrative Learning Experience. The narrative review is called The Interplay Between Family Planning Choices and Cancer Risk, a narrative review of epidemiological evidence and mechanisms. To start off, we'll do our CEPH Foundation competencies, which is evidence-based approach to public health and healthcare systems, planning and management to promote health. The second part will be the MPH track competencies, apply biological principles to development and implementation of disease prevention, control, or management programs. Apply evidence-based medicine concepts to inform public health policies and regulations. Discuss public health unique characteristics, contributions to preventative medicine. Next, we'll talk about the background, and I just want to say welcome to everyone today. And we're going to delve into a critical and intricate aspects of women health, the interplay between family planning choices and cancer risk. Our narrative review explores the potential connection between various contraceptive methods and the development of specific cancers, including breast cancer, ovarian cancer, cervical, and endometrial cancers. By examining both epidemiological evidence and the underlying biological mechanisms, we aim to shed light on the nuanced ways in which family planning decisions may influence cancer risk. The exploration is vital for informing healthcare providers and patients, enabling them to make informed choices regarding reproductive health and cancer prevention. Next, we'll talk about the research question, and this is how do different family planning methods influence the risk of developing breast, ovarian, cervical, and endometrial cancers based on concurrent epidemiological evidence and underlying biological mechanism. This question aims to guide the exploration and synthesis of the available research on relationships between contraceptive choices and cancer risks. The methods we used, we started with a literature search, conducted a comprehensive search of peer-reviewed articles, reviews, and studies using databases such as PubMed and Google Scholar. Then we made inclusion and exclusion criteria and used data extraction. Data was extracted, relevant data from selective studies, including study design, sample size, family planning methods, cancer type, and key findings. We then synthesize the findings by summarizing and synthesize the evidence from the extracted data to identify patterns, consistencies, and discrepancies in the research. Discuss potential biological mechanisms underlying the observed association between family planning methods and cancer risk. We did a critical analysis, evaluated the quality and limitations of the included studies, assessed the strength of the evidence supporting the association between contraceptive methods and cancer risk, and then we had a discussion and recommendation at the end of the narrative review. We did this by interpreting the findings in the context of the current knowledge and clinical practice, provided recommendations for healthcare providers and patients based on the synthesized evidence. This is just a visual representation of uh, how we got to the final few articles. Then the results and findings for the breast cancer mixed results across studies, with some indicating a slight increase in risk associated with certain hormonal contraceptives, particularly in long-term users. Other studies found no significant increase in risk, emphasizing the need for further investigation. Hormonal contraceptive use may influence breast cancer risk through estrogen and progesterone pathways, potentially affecting cell proliferation and apoptosis. Ovarian cancer. Strong evidence suggesting that the use of oral contraceptives is associated with a reduced risk of ovarian cancer. The protective effect appears to increase with the duration of contraceptive use. Reduced ovulation and subsequent decreased trauma to the ovarian epithelium may lower the risk of malignant transformation. Cervical cancer. Some studies indicate an increased risk of cervical cancer with long-term use of oral contraceptives. The risk modulated by the presence of HPV infections. Hormonal changes may influence the susceptibility of cervical epithelial cells to HPV infection and subsequent carcinogenesis. Endometrial cancer. Evidence suggests that the use of combined oral contraceptives is associated with a reduced risk of endometrial cancer. The protective effect persists for years after discontinuation of contraceptive use. Progesterone is in combined oral contraceptive counteracts estrogen proliferation effects on the endometrial lining, reducing cancer risks. Here's a paragraph from some of the relevant studies showing the relative risk of certain cancers. As you can see, breast cancer is 1.2, meaning there's a 20% increased risk for breast cancer. Endometrial and ovarian cancer has a decreased risk, with cervical cancer also showing a increased risk of 1.3, meaning there's a 30% increased chance of cervical cancer. And one of the studies showing that there was also a decreased risk for colorectal cancers. For the discussion part, the evidence for breast cancer, the evidence suggests a potential increase in breast cancer risk associated with use of hormonal contraceptives. Study indicated an elevated risk, particularly with long-term use. For ovarian cancer, on a more positive note, oral contraceptives appear to provide a significant protective effect against ovarian cancer. This protective effect is thought to result from reduced ovulation frequency, which decreased the number of times the ovarian epithelium is disrupted. For cervical cancer, the relationship between contraceptive use and cervical cancer is more complex, while HPV vaccination has been highly effective in preventing cervical cancer. The role of hormonal contraceptives remains less clear. Studies suggest that long-term use might increase susceptibility to HPV infection, which is the primary cause of cervical cancer. Endometrial cancer, the use of combined oral contraceptives has consistently been shown to reduce the risk of endometrial cancer. The clinical implications of these findings have significant implications for clinical practice. Healthcare providers must balance the benefits of contraceptive use in preventing certain cancers with the potential risk. Individual patient history and risk factors should guide contraceptive choices. For instance, women with a family history of breast cancer may need to consider alternative contraceptive methods. Future studies should focus on a long-term, large-scale cohort analysis to further clarify these relationships. There are also a need for more research into the biological mechanisms underlying the observed effects, which could lead to the development of safer contraceptive options. In conclusion, while hormonal contraceptives offer significant benefits, including cancer prevention, they also carry potential risks. A further understanding of these risks and benefits is crucial for making informed family planning choices. By continuing to investigate and understand these complex interactions, we can improve patient care and outcomes. Here's all the references that I used, and I want to thank you once again for listening to my presentation.